When doing your searches and looking for a research topic, it's important to narrow your topic so that it's something that is researchable. One of the problems is if you put in something that's very, very broad, you're going to get thousands and thousands of articles, and it's really hard to narrow down the topic. So, for public health, a lot of the times we might look at Healthy People 2020, which are goals that are written by the government every decade or so, and it's an outline for how to improve the health and health status of the citizens in the United States. So under, for example, clinical preventive services, you can see that this is very, very broad. One of the things is about vaccines. And if you wanted to make that more specific, for example, this one, you could use vaccine resistance as your topic. Another one that's very broad might be injury and violence, injury, deaths, and homicides. They're both very, very broad topics. To narrow them, you might look at something like injury, deaths from falls, or homicides by firearm. Under mental health, suicide is very broad. You have to think of some kind of way of narrowing that. Maybe screening for suicide, or my suggestion would be suicide hotlines. Are suicide hotlines effective interventions in prevention? Then there's one about adolescents with a major depressive episode in the past 12 months. That's not a research topic. That would be a statistic. That would give you a number. So to actually search for something that would be useful as a research project, you could look at screening for depression in adolescents. Under nutrition, physical activity, and obesity, we know obesity is a problem among children and adolescents. So let's add some other parameters there to make this a narrower search. We could look at child obesity and bullying and see if there's a connection there. Another way to do it is to use particular aspects to narrow your topics. You can always add an age. So let's say we're looking at falls in the elderly, or we're looking at suicide prevention in the adolescent. You could also limit by gender, male, female. Socioeconomic status is often used to limit the search range because you can look at people in poverty, you can look at underserved populations, ethnicity is used, geographic location can be a region or local information. And in public health research, there's always a lot of urban versus rural comparison because the health status of people in urban settings and rural settings are very different. So for this particular search project, I'm going to be looking at tobacco use as one of the 2020 Healthy People 2020 topics. When I go into this lower, tobacco use is very big, and I go drill down, it talks about increased recent smoking cessation successes by adult smokers. And it's looking, and they're even adding it as they revised it to add evidence-based strategies, which means we're looking for what the research tells us is effective interventions. We don't want anecdotal stories about this worked here and that worked there, but we want something that means that shows that it's something that can be translated to a general population or to a population under study. So when I work this out, this is the search statement I came up with. Do e-cigarettes help current smokers who have tried to quit before finally succeed in quitting? So this is the topic that I'm going to go searching on. And it's got 3 concepts in it. E-cigarettes, smoking cessation, and quit attempts. Those are the 3 topic concepts I'm going to be searching on.